Like, is high fructose consumption actually correlated with bad stuff clearly?
Yeah. So, I mean, I can talk a bit about the areas that I'm not an expert in, but I think are generally well consensed, such as you mentioned it, fatty liver disease and consequences of these sorts of, inflammatory and chronic liver diseases, as well as, obesity, et cetera. You had a wonderful guest on that talked about its contribution to cancer development. And in fact, colleagues here at Memorial Sloan Kettering, where I'm at, have also seen similar things where, fructose can contribute to leukemia development. So leukemic cells, unlike normal stem and progenitor cells in your bone marrow, those leukemia cells can actually use that fructose. So that's a rare adaptation that they're very good at doing. And that's because fructose can be high in your serum, in your blood. And then, where I come into this particular discussion is again, as a trained psychologist, I became really interested in the epidemiological, I'll call it, correlation between, this even pre-COVID, but especially post-COVID in not just the United States, but in the much of the Western world, huge increases in, developmental, what we call neurodevelopmental diseases. So
Mhm.
diseases, mood and anxiety disorder development, autism, spectrum disorder development, even above the diagnostic increase, right? Like even though we're better at diagnosing things, there's still increases across the board in a lot of these, and a lot of really striking and strong correlations with this increase in fructose consumption, and in fact fascinating studies showing that even and we'll get into this, but even a single, you give a pregnant woman, a glass of juice, you
Mhm.
can actually measure the fructose in the breast milk after a single glass of juice. You
Hmm.
can measure that spike in fructose in the
Hmm.
breast milk. So this sort of, correlative and suggestive data beyond, the thing we know about fatty liver disease really got us interested in, what could this be doing to neurodevelopment.
Mhm. So does high fructose consumption in either pregnant women or young people, children, does it correlate with neurodevelopmental issues?
Yeah, and quite strongly actually, and I think there's a growing consensus on, I say correlation, and they do causal modeling, but really there's never been, you can't do that, right? Like that
Right,
would
right.
not be
They like,
particularly ethical
yeah.
to do. And of course, I want to just make clear too that though in psychology it's called a two-hit model, that
Mhm.
is you have a combination of susceptibility and a triggering event or triggering events, right? So classic example would be, for schizophrenia is you have overbearing or prodromal, symptoms or an overbearing mother combined with, let's say, a traumatic event or something happening that might trigger, that disease. And so for us, it was a lot of the evidence suggested that it's increasing the susceptibility
Mhm.
to these diseases, and it's both. So it's both in pregnant women, the offspring of pregnant women, as well as adolescents too, who
Yeah.
consume
Yeah.
fructose.
And just to give people some sense here. So I wrote an article about fructose some time ago. I did a back of the envelope calculation just using numbers that are published out there. We know, I mean, because we know how much sugar sweetened beverages out there. Like you can get a pretty good calculation of how much fructose, say, the average child is consuming today. And then, like, it turns out wildlife ecologists know how much fructose chimpanzees eat. And normally when we think of a chimpanzee, we think, okay, it's an ape living out in the world in the jungle and they eat bananas and fruit all the time. And bananas and fruit are some of their diet.